Good morning. Thank you for your introduction. It's not moving. Oh, okay. So, as we know, fluoroscopy and interventional radiology is the third major source of ionizing radiation in medical diagnostic context. And due to the technological development, it has expanded to the surgical specialties and operating rooms. It involves patient and healthcare professionals with no specific education in radiological safety and protection, and can lead to excessive exposure to ionizing radiation in the operating room. Previous studies have indicated that the professionals possess heterogeneous, inadequate knowledge of ionizing radiations, suggesting that there are room for the improvement and the education of these professionals. Considering the proximity of the surgeons and the surgical team to the X-ray equipment and large exposition time, exposition dose in professionals can assume considerable values and increase risk to develop the deterministic and the stochastic effects on the professionals. There have been numerous studies in the different specialties like hemodynamics, angiography, gastroenterology, and others with the highest risk to the exposure. However, in the specialties like orthopedicians, these studies were never made, and there's need to perform these studies. So, this way, in order to study levels of the ionizing radiation received by medical professionals, the scatter radiation dose measurements were performed at different positioning, simulating hip surgery. The measurements were made as function of height, of distance, and the variation in the dose rate around the phantom. So, in this study, we used the whole body phantom to simulate the patient. C-arm Philips BV300 were used to produce the X-ray, and we used three different positions at the 0 and 90 degrees. Atomtex ionizing chamber was used to measure all the radiation, all the exposure, and we simulated the hip surgery because in the previous statistical study we assumed that this one is the most frequently done in our hospital. So, the phantom was positioned into simulating the surgical procedure involving the hip with the positioning of our phantom as is used to be at our department. Parameters that we used were also taken care from our statistical study, and we see that the next parameter was used 67 kV and 2.4 IM at the configuration 1 at the 0 degrees, and 76 kV and 2.8 MES at the 90 degrees. So the measurements were done in different functions. In case of function of height, the measurement was performed at the distance of 25 centimeters from the center of the image, at the position A and B at the 0 and 90 degrees, and at the height from 10 to 10 centimeters from 0.1 and 1.8 meters. In case of the function of the distance, our monitor was placed at the height of 1.25 meters, and the measurements were performed between the interval of 0.25 and 1.65 meters, repositioned in increments of 10 centimeters. In case of the variation of dose around the phantom, the monitor was placed at the distance of 1 meter from the center, at the height of 1.25 meter because of the plan of the incidence of the radiation beam, and our detector was moved in increments of the 15 degrees all around the phantom. So as the results, we have here a variation of the scattered radiation in function of the height at the position 1 at the 0 degrees, and we can see that the highest doses were registered at the chest level, as we can see 1.167, and the thyroid levels was 0.481. Here we can see the dose was registered at the second position. Also at the chest level, the dose was higher. Here we can see variation due to the distance. We also calculate the distance through the square law, and we can see that at the distances inferior at 1 meters, this law underestimated the doses. And here we can see the scattered radiation as function around the phantom. With this data, we calculated the exposition of our surgical team, and we estimated that the lead surgeon receives approximately 34.6 microsievert per procedure. So, according to the International Atomic Energy Agency, the exposition should not be more than 5 microsieverts. So in our study, our doses were inferior. Considering that the X-ray beam with energy between 60
Can you stop, please? Can you just say your last slide, please?
Okay. This one. So as we can see, the doses are low, but we need to use our safety equipment, goggles, thyroid protections, and the aprons, so we can reduce the radiation, and we should always perform education and promote formation at the safety and radiological procedures for all professionals in operating room. Thank you.
Thank you for the very comprehensive study.